Dear students, last class we have discussed almost half portion of the staff development program. If you have not seen the previous slide, please go and see that. Okay. So in this class, we will see that the remaining portions. So skill training already we have discussed. Now the next one is the managerial training program. Okay. So what is it? It's a form of staff development that is growing in popularity. Nowadays, for the managers, we are planning that's a leadership development program or managerial training program. That's a different aspect and that's very common. So it is needed by managers at all hierarchical level, especially for their further growth. So enhancing the management skills of the first level nurse managers, that will produce the greatest improvement in the patient services. So if you are giving some training to the managers, so that will help the patient services. We can improve the patient services. Okay, that's a managerial training. Then the management training program is to increase the managerial skill. What is the purpose? Is to increase the managerial skill. So the content of each management development program must be individualized to fit the need of the agency and the individual managers. So we have to select the topic according to the need of the organization. So they will choose it and according to the need of the individual also. And which all the courses is or training is suitable for that particular organization's need, and that manager is efficient in qualifying that or undergoing that training program, so they can choose that person and they can undergo the training. So that is the meaning of the managerial training. I think it's clear. So then we can see some staff development models. I am not going in detail about the staff development models, but a brief view of the staff development model. Mainly two models we are discussing here. The first one is the Rptam model. So the picture it's given. I'll give you a brief explanation about that. So this is a research-based model and it's created by in 1981 by Woods, Thomson, Russell. Okay. So that is one of the comprehensive model for the staff development. So this model conceptualizes into 5 stages. First one is the readiness. R means readiness, P means planning, T means training, I means implementation, and V means, fifth one is the M means maintenance. Okay. So each stage focuses on several practices. I will just briefly explain that each phases. So the first phase, this phase is readiness phase. So there the positive climate before the staff development activities are attempted. During this stage, what they are doing, so they will set the goals for the staff development and formulated by gathering the information of regarding the current practices and then identify the need for the specific staff. Okay. So they have to identify the group and identify the need also and the related information. Second one is the planning stage. So all the activities regarding the staff development program are planned, okay, before the implementation. What is the actual goal of that conducting this program, and who all are the target groups, and then specific objectives, and then their content planning, and these all things, who all are the person involving in that, everything is then planned. Then training stage. Okay, the group is trained as per the planned program. Okay, Then comes the implementation stage. During this stage, the implementation of training imparted to the employees is put into practice. That's during this stage we are giving the training. Then maintenance stage means evaluation of the procedures and the program outcome, and then changes are recorded for the purpose of improving future staff development efforts. So then just we are make sure that they achieved it, or if they need some improvement in some areas, we can reschedule that. So that is the implementation and maintenance stage. So these all are the 5 stages of RPTIM model. Okay. I think it's clear. Readiness stage, planning stage, training stage, implementation stage, and maintenance stage. I think it's clear. Then comes the second stage, that is the modified lava model. Modified lava model, here they are discussing that. So this lava professional development model, it's known as, okay. So here it provides a guidelines to conduct staff development program in nursing, okay. So here comes again that different stages are there. The first stage is the cyclic, it is planning stage. You can see that. So the planning component comprises of 4 steps, that is collecting and analyzing the information required for identifying the needs and area for staff development. So we are gathering the information, that is the first one in the planning. Then we are setting the goals and objectives for the program. Second step is the setting of goals and objectives. Then we are selecting the content, which content we are going to deal during the implementation stage. Then designing process, that means the blueprint. The whole program is designed, what, where, when, how, and why. Every aspect is planned and finalized in the planning stage. So then comes the ongoing components. That's this component comprises all the activities to be carried out continuously. That is training and learning activities, implementation, and formative evaluation. That means periodic evaluation during the training, that is known as formative. So this training is conducted as per the plan based on the effort made during the planning phase. How we have planned the different pre-test കൊടുത്തിട്ട് കണ്ടൻറ്റ് പ്രസൻറ്റ് ചെയ്തിട്ട് then post test എങ്ങനെയാണോ പ്ലാൻ ചെയ്തേക്കുന്നത് thereafter they practice and monitored for their performance. അതാണ് ongoing componentsൽ. Then last one is the program or summative evaluation. So the participants are evaluated for their performance in terms of the final outcome for fulfillment of organizational goal through the summative evaluation. That may be a post test or maybe an evaluation checklist, or whatever measures we can utilize for the summative evaluation. So these all are the different steps coming under it's a cyclic professional development model or LOVA model, LOVA professional development model, IPDM it is known as. I think it's clear. These two models commonly we are using. Okay, that's the first one is first model is the RPTIM model, and second one is the LOVA professional development model. I think it's clear. So then the learning principles for any learners, the same thing only: readiness to learn, motivation to learn, and condition for practice, and reinforcement. So that is the learners, we know that the principles of learning in the base another, it has to be there with the learners, then only they can learn it if we are administering the staff development program. Then comes the functions of staff development personnel. What all are the functions? So we are determination of the administrative structure of the staff development program, then distribution and establishment of organizational methods, policies, and procedures for SDP, Then determination and establishment of lines of communication and what all the facilities we are utilizing, who all are the resource person for the SDP. Then organizational and individual staff development priorities we are determining. Then measurable short and long term objectives for the staff development program. Then promotion, development, implementation and evaluation of program to meet these objectives. Okay, that they have to take step. Then planning, coordination and utilization of community resources, how we are utilizing the resources to meet the organizational goal or objectives. So these all are the functions of staff development personnel. Then comes, this is a simple step for the staff development program. Okay, it is one of the types. Then again I will discuss in detail about how to plan a training program. Okay, planning and organizing the any type of staff development program. So this is a simple step they have given: assessment, implementation and evaluation. In the assessment point they have given here, we have to find out the needs for staff development program. Then we are prioritizing the needs, then we are setting the objectives, then developing the criteria. Then in the implementation stage it comes the climatic checking, okay, where we are conducting this resources what we require and the setting and who all are the resource person, everything is there in this stage. Then actual implementation of the training and ongoing monitoring. Okay, then maybe pre-test or what we are doing, demonstration or whatever it is. Then evaluation comes the establishment criteria and then pre-test to the participants, then post-test after completion of the training program, then observation of the transfer of learning to the job, that may be by written demonstration or simulation or skill performance. Then follow-up studies for assessment of extent of retention of learning, that may be for long-term periods by using any method. They can get the feedback from the participants. So these all are the simple steps coming under the staff development program. I think it's clear. Then the actual another method for planning and organizing the in-service education program, that is specific. Okay, so this planning and in-service education, organizing in-service education program. So here comes, it's a learning experience. So this learning experience, it's given by the William G. Torphy. He is developing this educational or training program. So according to them, the training process consists of basically 4 steps. After that, this Cremato and Rigger has in 1990, he has modified this and it's given here: assessment, design, implementation and evaluation. To follow up: assessment, implementation, evaluation and follow up. These all are the steps coming under 4 basic steps for the planning and organizing in service education program. So we can see that in the assessment stage. So during this stage, this organization and its employees' needs are determined. First we have to determine that what is the need of the organization and what are the needs of these employees also. Okay, where the deficiency is there or the performance deficit areas we are identifying, and then we are gathering the relevant information, and then their knowledge, skill and training desires and expectations of the staffs are gathered. So after gathering these all information, then organizational analysis, operational analysis and personal analysis we are conducting. Organization and analysis is not what for this one, to identify where the training is required. okay, where the training is required. Then need എന്താണ്, ആ ഏരിയ ഏതാണ്. Then operational analysis to identify the possible content of the training. What content we requires to give the training. Then last, personal analysis, who needs, okay, who needs what type of training. That means the personnel. Okay, അപ്പോൾ organizational analysis identify where the training, എവിടെ വെച്ച് training. Second one is the purpose, identify the content. Third one the person. Okay, so this information may be collected through individual or group interview within the, maybe from the target population or participants, or maybe records, observation, survey, or any methods they can utilize the identifying the area of their conducting the in-service education program. Then the second step is the design. Okay, so in planning the training program, it's important to design the program or to have a blueprint of that. Okay, so what there we have to do the approaches like behavioristic approach. We are useful in teaching the psychomotor skills necessary to perform the task. And there maybe we requires repeated demonstration. നമുക്കറിയാം സൈക്കോമോട്ടർ സ്കില്ലിന് എപ്പോഴും നല്ലത് ഡെമോൺസ്ട്രേഷൻ ആണ്. കൊഗ്നിറ്റീവ് അപ്രോച്ച്, ദാറ്റ് മീൻസ് ഫ്രം ദ പാസ്റ്റ് എക്സ്പീരിയൻസ് we can collect it. Then humanistic approach is important to build curiosity among the nurse participants. So a combination of these three approaches are very important. So the design is what we have to prepare the program background, target groups, training climate, trainers and performance objectives, training topics, content, methods, learning outcome, budget, time target, and then what all required for that implementation of the before that in-service education. We have to plan for that, and for that a checklist has to be prepared, and then we have to make sure that fulfilled, the checklist is fulfilled before the implementation of the program. Then comes the implementation. It involves the completion of task analysis, that means specification of entry level skills and development of instructional objectives and identification of media and materials. So that's very important. Okay, prepare the participants for undergoing the training program. So we need to have a good physical setup. Okay, that is the prerequisite for an effective and successful training program. And then the trainers need to be mentally prepared, and she has to prepare all the necessary materials well in advance to present it during the time of conducting the program, and review the objectives of the program, and make a good rapport with the participants, and implementation also. Okay, during this stage. Then the last stage is the evaluation and follow-up. So this evaluation stage, enhancement and evaluation of training and development, that's very essential. That is a feedback area. So the training program is called training evaluation. Other name is that it is characterized as we know that formative evaluation and summative evaluation is there. So formative evaluation is used before it is fully developed and implemented. Maybe immediately after the completion of the program we can take that. Okay. Then the process evaluation involves assessment of participation, satisfaction with the training, and assessing the immediate effort of training of their knowledge, skill and abilities. And the summative evaluation, we are determining when the trainee or trainees actually they are performing their reality situation. After evaluation of that, how they are handling that situation or performing what they have learned during the training program, that is the summative evaluation. Okay, the effectiveness there only we can measure it. The organization can measure that output of their training program. So that's all regarding the important steps in the planning and organization in the or organizing the in-service education program. First one is the assessment, second one is design, third one is the implementation, and fourth one is the evaluation and follow-up. So how this knowledge has transferred in their workplace, and then only we can decide that they are learned something or what we have conducted that is effective or not. So these all are the steps. I think it's clear. Then the benefits of staff development. Benefits for the individual also and benefits for the staff organization also is there. Okay. Then for the organization, keep the nursing staff enthusiastic in their learning, develop interest and job satisfaction among the staff, develop sense of responsibility for being competent in the area of their work, and create an appropriate environment with opportunity for growth and communication, and helps the nurses in making appropriate and sound decisions, and they can solve the problems also and help them to adjust with the change in the situation, developing leadership skills, motivation and better attitude, encourage and achieve staff development and self-confidence, and the organization a better place to worker. So these all are the benefits of staff development program. So you can go through that. I think that's all regarding the different aspect of the staff development concept. I have discussed these two areas of in detail regarding the staff development program. So in this we have seen that the managerial skill training and the mainly two models we have seen, and then how to implement it. So during your exam purpose, they may be asking for an intensive care unit how to organize staff development program. There is a chance of applicable question also you may get. Okay. And this unit common questions are staff development program in general, and then maybe that there are types, and individually they may ask orientation program, in service education program, and continuing education program, and the difference between each one, and you have to organize one in service education for a staff nurses or college teachers or something like that. So these all are the common questions. So I think it's clear. If you have any doubt, you can ask me. I think otherwise we can wind up here. So those who are not subscribed my channel, please subscribe it and you will get the upcoming videos also. I think it's clear. Okay, thank you.